Good morning. This is the Personnel and Finance Committee meeting August 4th, Thursday at 9 a.m. Start with our item 1, which is public comments. Our public comments will be only two minutes per each person. You must keep to agendized items on the agenda, the amended agenda, if we're going to speak at all. So, has anybody got any comments to make? Anybody here present that has any comments to make? Good morning, Mike. Okay, we'll go out to the viewers. Is there anybody online that has any comments to make? Anybody online that has any comments to make? Okay, we'll close the public comments and begin with item 2, which is the approval of minutes.
It's a move to approve the minutes of July 7th.
Second.
Betsy moves, and it's a second to approve the July 7th minutes. Okay, item 3, resolution to accept a grant.
You got a vote on it.
Yeah.
Excuse me?
You didn't vote on it.
I'm sorry.
We didn't discuss it.
Do we have a discussion on the minutes? Any changes or anything? Can we have a vote?
All right.
Aye.
Aye. Aye. Oh, minutes are passed. First year of 2022. Resolution, item number 3. Mr. Guerin, would you like to introduce the grant?
You bet. This is a grant. Well, actually, it's multiple funding sources to support a lead abatement program for Winnebago County. We have applied for a grant with the state of Wisconsin to access federal HUD funds. We're also able to tap into some lead safe home program funding that the state has now, and in partnership with the city of Oshkosh, are accessing some of their CDBG funds. These 3 funding sources support a position of a lead abatement coordinator and allow us to begin to assure a competent contractor workforce and the identification of homes of lead poisoned children in Winnebago County or other at-risk housing in Winnebago County to remove the lead from those homes to help reduce childhood lead poisoning and help assure a safe environment for children in our home. We did budget some funds for lead abatement for this year in anticipation of this award. I do need to continue to work with Mike Collard on the budget implication, but in spirit here, it's really about accepting the grant funds and expending those funds on projects in Winnebago County.
Can we get a motion on the floor and a second to start discussion?
I move for
The acceptance of the grant.
acceptance of the grant.
Acceptance of the grant in the amount of $173,535, covering the fiscal year of 2022 to 2024. Have a second? Mr. Bender seconds. Don proposed a motion. Okay, discussion? Yes.
I have a couple questions. So so quite a few questions, actually. How are you, targeting certain houses? I know that, as a real estate agent, I always had to have a disclosure form for lead from anything before 1978. Understanding that they stopped making lead paint, I think in the late 50s or something, but they had to do that kind of. So, which houses are you targeting? And have we seen increases of lead poisoning? Because my understanding with the lead poisoning in the paint, or the lead in the paint, that a child actually had to eat the paint. So it actually had to ingest the paint in order for it to cause harm, if I'm not mistaken. And that sometimes when you remove it, that you actually, it's kind of like asbestos, where if it gets into the air, that's where it causes its damage, or if it's ingested, correct? So a lot of these old houses, I know they paint over top of it with this special stuff. I don't know if that's what you're planning on doing. And once again, how are you targeting? Is this just for people who, if they're in a program, a housing program, is this how that works? And now I'm gonna get to the finances part. Do you want to answer those questions
Sure.
before I get to the next question?
Yeah.
Okay.
I'll try. Yeah. So our primary target are homes of identified blood poison children. So children under age 6 with a blood lead level of 10 or higher. And those are homes that we would, as we identify those children, go out and take a look at, issue orders if necessary. Biggest barrier to making that home lead safe is usually the capacity to pay for the abatement. And so while we'll target those homes with lead poisoned children, we'll target homes that lead poisoned children spend time in. We'll additionally target, pre-1950 housing, either rental or owner occupied, with a value no greater than 150,000, I think, for a single family dwelling, 200,000 for a duplex, that agrees to rent to a family with children under age 6 for at least 3 years. And so in addition to abating homes or removing the lead from those homes, and there may be, in some instances, complete abatement or the removal of that lead. In other cases, there may be some encapsulation or securing that old paint in place such that it doesn't become a hazard. The children do become poisoned from eating paint chips, but they also become poisoned from lead dust that's generated on friction-based surfaces, such as windows and doors. The lead can be found not only in paint, but in old varnishes. It can be in the soil outside the house. And so there's a number of ways, but paint is still the primary pathway for lead poisoning. Lead in water is a contributing factor, but not nearly to the degree that paint is. These funds will allow us to offer 85 to 100% of the costs of the abatement. So if a home, for instance, needs new windows, it's going to cost $15,000 to do that in order to make that home lead safe. The funds that we can access will pay 85 to 100% of that. We are sensitive to the contractor issue because you're right. If you disturb lead paint, you can make the situation far worse. So the work has to be done by licensed and certified contractors that are trained in lead abatement. We remove the families from the homes during the project period and do clearance testing on the home prior to pre-occupancy.
Are the numbers really high with lead poisoning in this area?
We have,
How many people how many children are we talking about?
yeah, I would say that, we probably have outstanding orders on, maybe a half a dozen homes right now. The state just sent us 3 that they're aware of that would be eligible for this program. All blood lead levels over 5 are sent to the health department. I want to say in a given year, we probably receive maybe 50 or so of those results, and I'm estimating right now. We also do blood lead testing here at the health department for WIC. And for any WIC participants that haven't had a blood lead test, prior to turning 18 months old. And all of those families over age 5, under age 5, but over a blood lead level of 5, receive outreach from our staff and may receive an inspection, and that may result in orders.
And now the financial part,
Mhm.
mind if I keep going?
Yeah, kind of curtail it a little bit here.
Okay, well, the financial issue is, so this is a 2-year grant and we're hiring someone for 2 years. Does this person know that it's a temporary position?
So it's not intended to be a temporary position. The person that's hired for this position does know that they're operating under these grant funds and that it's a fully grant funded position. And if those grant funds go away, we won't have capacity to keep that position going.
Okay,
So,
that's it.
Anybody else? Yes, Steve.
You know, there's an awful lot of lead water lines. Are we gonna address them too in that same time? Because pretty much any house built, in the 50s and 60s has lead coming from the road. City of Oshkosh, when they rebuild the streets, basically make the homeowners replace the water lines. But if you're talking a child under 6, you could pull all the windows out of there and it could be contaminated water coming in there that's giving them blood poisoning. So are we gonna also basically, the money's not gonna go very far, the little money we have, you're not gonna do many houses. So is that also the plan to basically replace the water lines?
So this funding is specific to lead and paint. There are other funding sources available for lead and water. Many communities are looking at that now. Some are applying their upper dollars to that. There's also specific grant funding that's available to communities to help replace those lead laterals. So in short, this grant will not address lead laterals. But yes, I agree that that's an important issue.
Because that would be my concern, that we replace all the windows and the woodwork, but yet we don't address the water coming into the house because that's coming through a lead service. And, we're taking care of half the problem, but the kids drinking that water.
Yeah, and that's correct. The homes that are at highest risk for lead and water are those that have lead laterals to begin with, and that there's a disruption of that water line from street construction or something nearby. The water treatment plants treat water, add phosphates to it to help create a protective barrier within those pipes to minimize the lead that actually flows out of the tap. Still a risk, but a much lower risk than paint.
Any further? You go ahead. No?
I had the same question as Betsy about the length of this position. And it's not stated in here, so I think we should add an amendment or change the wording here to state that it's only for this period of time unless funding is continued.
If I may.
Well, I could address that too.
Sure.
Yeah, go ahead.
The lead abatement project coordinator is on the table of organization as a permanent position currently. So we're not asking the committee or the board to add that position. It's on the table of organization, was put on last year. I'm not sure if it was part of the budget process last year or if it was even earlier than that.
I think it was earlier than that. COVID put this project on hold first.
So we haven't actually got the project going, got the person hired yet, even though it's been approved by the board for.
So what this is just paying for.
Yeah. So yes, and that's one point I want to bring up on the financial side is, I was just talking with Mr. Garrett before the meeting, in fact, trying to work some of these things out, but I have a concern about the budget transfer that's attached to this. It really should be a budget transfer because it's already budgeted. In other words, the salary for the position and the fringes are already included in the 2022 budget.
Oh.
And
Estimated costs.
yes, yeah, it's always estimated, but budgeted like we would normally budget a newer vacant position. So we don't need new money to be appropriated for it. Some of the other costs, it's not entirely clear at this point to me whether there might be a need for extra money. There's the other contracted services line. But at this point, I can't recommend a budget transfer for things that include, already budgeted items. That's not appropriate. So what I would suggest we do for now is It's still important to have the resolution to accept the grant. But just to take out, I would ask the committee to take out the language approving the budget transfer that I included in the draft. Because I thought that, based on the information I had preparing the packet, I thought a budget transfer might be necessary. Now it's not at all clear that one will be necessary, and certainly not in the full amount, in my opinion.
You
So,
want to take
so I just look.
line item 20 out of there entirely?
Well, yeah, after it says Winnebago County, I just put a period there and take out the and approves the attached budget transfer, and then I can amend the fiscal note. So that's my prerogative.
And at this point, I don't know what that means.
Yeah.
You know, I mean, since we've budgeted for this, we've actually secured the funding now that we had budgeted for. You know, I don't even know if this needs to proceed beyond personnel and finance to county board or not. It might get released, you know.
The acceptance of the grant would have to be approved by the county board.
I have a question. If it was for 2022, why does it take 8 months to get the project going? I mean, why did we waste 8 months to do this?
We didn't get funding until June 30th.
Pardon?
We didn't.
He said it does.
Pardon?
He just told me that it was in the 2022 budget.
Yes,
I'm saying, why does it take 8 months to get the project going?
It took, the position was approved by the board, and the funding, the county side was approved, along with the revenue from the state was included in the budget. But Mr. Guerin is saying that the state didn't actually approve spending the money, giving us the money to spend until June of this year.
I mean, I still don't understand it.
What if that funding didn't go through what we really have done?
Not hired a person. Yeah.
All right. So what we are going to be approving is just the acceptance of the grant as it reads here. Authorization of the, authorization acceptance of the grant in the amount of $173,535 covering the fiscal years of 2022 through 2024. For lead abatement. That's our resolution. We have a vote.
I,
I,
Aye. Steve? Okay, aye. 2-5. Passed. Second resolution here. The resolution authorizing acceptance of mobilizing community for just response grant, or MC4JR, in the amount of $63,089 to support the Just Recovery Initiative for communities disproportionately impacted by the pandemic, by structural inequalities, and for all public health issues. Motion. Why don't you explain the entire thing first before we?
So this is funding that was made available from the CDC to states for health departments to work on some of the disparities and equities that were highlighted by the COVID pandemic. We know that some communities were impacted more than others. The intent of this grant is really for us to assess some of those disparities and equities, the damages, communicate with those affected populations, much like we do now when we do a community health assessment and use that information to put together a community health improvement plan. We want to better understand the issues that were really unearthed or really seen much more so during the pandemic than prior to the pandemic. Identify opportunities to better work with these impacted populations, identify and make recommendations on how to move forward to better support these populations that were negatively affected. it's an information gathering, relationship building type of work that will result in recommendations for future action. So I get that it's, there's a lot of words and it's kind of hard to, understand what exactly is going to happen, but imagine, we're going to be able to use this grant to provide staff capacity to work with these impacted populations, develop those relationships, collect that information, hold some listening sessions, look at data and make some recommendations on how we can better support our local Winnebago community.
Is this a position,
No.
position for the table of organization?
No.
Somebody want to make a motion?
Second.
The full motion, please. Just the top. Can you read that?
I'll do it. Let me do it.
Read it.
Resolution, authorize acceptance of the mobilization community for a just response grant in the amount of $63,089 to support a just recovery initiative for communities disproportionately impacted by the pandemic by structural inequalities and for all public health issues.
And second,
Betsy already seconded, Dave first. Betsy
Dave,
second.
okay, Betsy second. Dave read the motion. Do we have any questions on it? Yeah, go ahead.
Okay, so I'm gonna go similar to what I said last time. So, how are you targeting or how are you determining where you should go? Financially, this is a one-shot deal for this grant, correct?
Heidi Keating is our public health planner and is really leading the work on this grant. I asked her to come to answer any questions.
Initially, and last year we had key stakeholder interviews, so we have some data from our community partners as to areas of kind of greatest need. So we start there. You just think about families, low-income families, families with small children. There's a childcare crisis, so families trying to secure childcare and afford that. Also, refugee families, families in rural areas, families that have, different subpopulations in our community that have been disproportionately impacted. So we know some of that information, and so then we work with our community partners to help us identify, a group of people that we can have a listening session with. And, some of the funding will be used to remove any kind of barriers to say if we need to provide childcare so they can attend a session and that kind of thing. And so, it's a effort with the community to help listen directly from people.
And when you say listen directly, what's like the template of how you're doing this? So are you, is there going to be a question answer or they just get it together in groups? Is this going to be a complete fest or is this going to be, this is what's working, this isn't?
Right,
How
and
does
we
that
have
work?
that, we have some options built in where, we can use a facilitator. And, what we want, part of it is building relationships that we're there to listen. If there is a complaint fest, we're there to listen. A lot of, populations, their voice isn't really heard. And so we're trying to, build community, build trust, acknowledge things that, that the COVID pandemic was really difficult. And then, ideas moving forward, things, listening to people impacted and what are things that are really important for them rather than, somebody else identifying what's important.
Is this a series of home visits?
No, it would be like a, determining a place and holding a listening session, like a, kind of like a group, focus group type of thing.
This could be at a community center, a church, some comfortable community location for the population that we're looking to gather information from. So this is, as I mentioned before, this is not that much unlike other information gathering that we've done in the past in order to, assess the community and make recommendations. A bigger example that you maybe relate to is our overdose fatality review, for instance, where we bring together community stakeholders. We review current conditions that are existing in our community, in this case with overdose fatality or overdose deaths. And by discussing those deaths with our community and our community partners, we're able to, try to identify ways to better intervene or prevent future deaths. And in this case, what we're trying to do is really identify barriers and opportunities moving forward to better support some of our more disparate populations in Winnebago County. So these recommendations, these recommendations will be shared out. It's not just public health, and it's not just public health's role to solve those problems. But the more we know, the better we can respond as a community to what those issues are.
Any other questions? Steve?
I guess my greatest concern is just the staffing. I mean, we have over 90 positions right now open in the county. We got a nursing home that's basically running at very little capacity. And we're going to take time away from our personnel to fill more positions. I support them 110%, but I just think we keep adding people and we have so many openings. I don't know how we're ever going to get this county back up and running. And when we fill these positions, when and if, will we have the staff to even do anything with the data that they collect? Because every department is short so many people that it's like, we can create all the jobs in the world, but if we have nobody to hire, it's just another empty spot that we have. And I don't know how the personnel director ever fills what we have, let alone the new positions we're creating. I mean, I'll support it, but I think we're just basically doing something to feel good that this isn't going to go nowhere, because I bet you by the end of the year, we don't have any of these positions filled.
John?
Anything that the CDC has their hands in, I think we gotta be suspicious of, because they have a history of lying to us and deceiving us. And this thing is full of virtual signaling and all kinds of, it's just gibberish, really. And there's no way I'm gonna be able to vote for this. Lots of words telling us very little. We have no idea what this is, what the real motive is behind this. It's just no way to know.
Doesn't the Human Services have various people that are interacting with the community at this time and finding this kind of information out, can find this kind of information out without having to go to an individual grant?
So Human Services does provide direct services to a fixed slate of benefits that are available or funded. This grant is about collecting information not only from people that obviously are in need and are of low income, but also face other challenges within the community. And it's by understanding those challenges that we can better, equip, ourselves and direct future funding to be most effective. The more we know, the better we can apply the resources we have. And really, this is an attempt to identify what are the current barriers in our community, what are areas that we have an opportunity to work on and apply our resources in a meaningful way, and hopefully result in a positive change in health for our population as well.
Could I just, so, you know, to your point, anywhere that you are in the process, so some people that were awarded this grant, already had something identified, like they were gonna work on housing, housing shortages that, you know, a lot of communities are facing right now. Other, you know, examples that they say is like, you know, to, work on, say, paid sick leave, you know, so more families are able to obtain paid sick leave. That was something during the pandemic that, you know, really put a burden on families. So we didn't have a project specifically identified. So in order to identify that type of project, where it's where we talk about addressing those systemic issues, we need to listen to people first and people most impacted. So we're kind of starting at the beginning. And then, you know, as far as like how we get this implemented, we do have to work with our community partners. The health department is, you know, it's 50 people. We can't, you know, but we do have, and in building those community partnerships just takes time, and it takes opportunities to meet and work together on problems that we have prioritized. And so this, and that's part of the community health assessment process that leads to the community health improvement plan. And this information that we're working with community that have struggled, populations in our county that have struggled, can help inform our community health improvement plan. And that is a group of community partners from our hospital systems to our school districts to, you know, police, fire department. You know, we have nonprofits, we have, you know, some churches involved in that process. So we are working with the community on those identified issues. And it's a process that takes, you know, that building those relationships and building trust with one another and getting kind of returning to the work that we did pre-pandemic.
And having the opportunity and having support to actually collect data and demonstrate need is the basis for additional funding. You know, we can say that, you know, we need money, you know, for, you know, low-income housing or availability of access, but if we don't, you know, if we don't have data to support that, it's a lot harder to be successful in leveraging additional funds. And so this is just part of the cycle that is continuous, you know, information gathering, assessing, you know, determining needs, you know, making recommendations, applying for funds, you know, and it's just a continuous cycle. And this was just a nice opportunity for us to be a little more deliberate with funds made available from the pandemic to better assess our community.
Any other questions, Jess?
I mean, I have to listen to Dawn a little bit too. I mean, I do have a little hesitance with anything that says CDC reporting at this point because I feel like they have garnered a little bit of mistrust lately. So I get Dawn's hesitance for sure with that. When it says CDC reporting, it does make me a little hesitant. But as I'm understanding, so that I have a clearer point when I make a vote, this is something that you were probably starting to do anyhow, and then this just financially supports it.
Yeah, I mean,
It's just getting the money to do something that you were prior going to do,
this,
that you already had in place, or you were
This-
considering doing this, or is it something they said you have to do it this way, or is it something that you were already going to do?
so we don't have to do any of this. This was an opportunity to really enhance what we're currently doing and to really have additional capacity. I mean, with these funds, we can help make it easier for people to participate in the process. We can hire a contractor or a facilitator to supplement our own capacity. So it really just enhances our ability to really assess our population.
And you said this is the bill trust, and I get that, but what if, I mean, and I'll bring in law enforcement with this one, what if you do discover drugs being brought into a certain area and any other type of illegal activity? I mean, do do you work with the sheriff's department also with stuff like this, or how does that work?
The information from these sessions, will be assembled and it's public information. The CDC part of this it's required. I mean, they're providing the funding. And so it's pretty typical in a situation like this that we have to show them how we use the money, and so the reporting standpoint.
I know that drugs has just been a big impact since, and overdoses and so forth with the, I think that's something else we're gonna be looking at today or the next meeting, I can't remember. So I was just curious with that and how that works with the.
Yeah.
the
Our
law
goal is to use the information that we collect, and if that is, it highlights areas of opportunity elsewhere for law enforcement or housing or anyone, we're going to share that information.
Okay.
Mike, is this a transfer of funds? Back in 22, the attached budget transfer, 2022 approves that transfer. This is a transfer of funds that happened earlier, and we are now approving the grant that goes overlays it.
No, the date is just the date I believe it was submitted to the Public Health Board.
Yeah, Board of Health.
So
This went to the Board of Health.
So it's only been approved by the Board of Health at this point. And I do have some questions or comments about the budget transfer, if you'd like me to address that as well. Because here, it's not quite the same as the previous grant, but there is some overlap with currently budgeted employee expense. In other words, this particular grant doesn't actually involve hiring a new position or a new person. It does provide partial funding to us for some existing staff who will be working on the project. So that portion of it already is budgeted. And again, really should be taken out of the budget transfer. Some other elements, contracted services, registration and training, operating supplies are not necessarily currently budgeted, I don't believe. So probably appropriately done as a budget transfer. So what I'd suggest to the committee is that if you look at the budget transfer, that we amend the budget transfer by taking out the expense line for regular pay and fringe, which are already budgeted expenses in the 2022 budget for the existing positions.
The situation where that might be impacted is if we were to hire a temporary person. In addition, we can contract our services, or we can hire temporary staffing to supplement our existing staff. And
That's in the budget already.
well, this would be an additional position. I mean, granted, if there's funds in here that are able to be used to cover existing staff, yes, that's in the budget. If we hire an additional temporary person, a project person, or contract, that's not in the budget currently. We don't know right now how many hours of, say, Heidi's time are going to be charged to this grant. And so we've included the entire amount in the budget transfer, just to maintain flexibility. But I agree with Mike that Heidi's time is already budgeted. There is opportunity to offset some of her time with this grant. You just don't know how much.
I would say there is a breakdown, on the project budget attributing essentially $27,000 to Heidi's time out of $63,090. There is, I don't know, I'm just sort of looked at this before the meeting, I agree, but there is a significant amount of budgeted money for temporary employees as well in the budget for public health that was added based on expected
For
grant funding of various types for COVID and related. I don't know if you're going to need more temporary, if you're going to run into a problem with your existing temporary employee budget, if some of these contracted services you decide to replace with essentially a temporary person, if you're able to hire it that way better, is that going to be a problem for you?
It probably won't be based on what we've budgeted. And it'd probably be great at some point for us to understand better how we should be, when we get a grant that we haven't budgeted for. I just try to bring the full amount of the grant forward hopefully apply that appropriately to our budget, such that our budget reflects at the project level the funds that are available. And if there's a better way for us to do this moving forward, certainly want to work with you on that.
Yeah.
Wouldn't it be better to do a transfer? Approve the grant, but do a transfer the correct way as he builds a need, then do the transfer at a later time.
We could do it at a later time
Right,
out of contingency fund but that's only up to 15,000. So that would mean another resolution to board if we need to do a transfer over 15,000. So I'm suggesting we can take care of it now. I think if we just take out the regular pay and fringe lines, leaving $36,090 to be transferred to the other contracted services and supplies and registration tuition lines.
The only concern I have is just I want to make sure that we have the authority to expend the full amount of the grant. That's all.
Sure. Well, and we still have the resolution accepting the grant. It's just, if you were to need more, if you would need to move money from contracted services to a temporary employee, we just then have to evaluate if we have enough budget available currently for temporary employees, which I suspect you would.
Steve,
I guess if we approve this as is, the money that's left at the end of the year just gets transferred back to the general fund anyhow. So it's not like you can spend the money anywhere else. I mean, I would just as soon approve it as presented. And at the end of the year, I mean, you know how much money is going to be left over from unfilled wages? I mean, we got 93 job openings that were all unfilled. It's all going to come back to the general fund after the first of the year. I would just as soon approve it the way it is. If you do need to hire some temporary staffing and then the money's there, you don't have to come back for it. I mean, if we're going to do it, let's do it and do it right so that we get the numbers that we're looking for, so we know how we need to go about helping the people. So I would just as soon approve it the way it is, and if the money's left over at the end of the year, it's coming back to the general fund anyhow. So it's not like we're saving anything, I mean, we're just amending something to take it out of his budget that maybe he'll need at a future date, and eventually it all comes back to us anyhow.
It may be
quickly, Betsy.
I
What about
was just-
David here? He
I'm
has
sorry,
signed up
David,
before.
first, yeah.
I was just gonna say something that my colleague just said about, and what Steve said is that perhaps it sets a precedence so that this is not the way that we normally do things, right? So that if something's already paid for in a budget and then to add it and then the way that it's written, I understand what Mike's trying to
This is
say.
the first time we've ever done that.
Oh, it is?
I've been on this committee for basically 3 years. We've never nitpicked these transfers.
David, go
I'm
ahead.
not gonna support it because I'm not in favor of adding another person to the table of organization.
There is no position associated with this.
There isn't another person being added to the table of organization.
That's
But there
what I
might be.
understood.
No, there won't be.
No. No, this is just the grant.
I understand, but it's coming that way, though. Whatever, go ahead.
The grant is not approving a new position in any way. The grant is approving the dollars being spent for the operation. Okay, the project. You still have an excess in that your transfer is for the full grant and you have used part of it already. Or not, you haven't used, the part you are asking for is in advance,
There's some overlap
right?
by using existing staff. To
Steve
get it
tells
going.
me that that's a wash. At the end of the year, it goes back into the
Yeah,
general
it may
fund.
be important to note that all of these grants are reimbursement grants. So we don't receive a lump sum of money to do this. We bill as we incur costs. I know that probably
Let's have a vote on the grant. Only. Those in favor?
Aye.
Don,
Nay,
I
Nay,
Aye. 3-2.
So, Mr. Chairman, is the resolution now approved with budget transfer? I'm just concerned because you said grant only. I wasn't sure if you meant to have a separate vote on the transfer, which is
You're,
also referred in the resolution.
that's a. Did you change, are you changing this transfer?
No.
No,
We're leaving the transfer alone. We're just approving the grant,
Resolution as is,
the resolution as is.
and you can bring it to the board if
Steve's right. It doesn't
Yeah.
really matter in the bottom line. I mean, I can
And I
understand that. It's-
And I can work with Mike. Maybe we can reduce.
We'll do that better in the future.
We can reduce the amounts in any budgeted item without,
Yeah, we just,
needing to bring it back.
we just leave it unspent and it'll be on both the revenue and expense sides. You'd be low on the budget reports, but you'd be low for other reasons anyway.
Well, in the future, I guess if you bring it to us the way you want to present it. But I've been on here 3 years and normally we don't amend the budget transfers. Due to somebody basically having extra money to cover the transfer, it's just, it would just make things more complicated for something that was basically
Transfer as well.
pretty easy. We approve it and we don't spend all the money. it comes back to us.
plus the health department might get mad at us for changing something that came through there. It's kind of like the highway.
Oh. Okay, we're on item 5. Item 5 is the authorized acceptance of public health and safety team grant, FAST, in the amount of $148,102 to develop the rapid response initiative aimed at responding to non-fatal overdoses and preventing overdose death. Hi,
I'd like to, if I may, I'll
yeah,
introduce.
would you please?
Yes, Ashley is one of our public health supervisors. She was really responsible for developing this grant and is here to help answer any questions you have.
Actually, go ahead.
So with the Public Health and Safety Team grant is through the CDC Foundation, which is separate from the CDC. It's the financial arm. So this grant is our intended purposes of this grant, excuse me, is to do startup costs for a rapid response initiative, which is a multi-partner initiative that will pair recovery coaches with folks after a non-fatal overdose or in need of recovery coach services in the community. The big intent of this is to help deal with our significant spike in overdose deaths that we've seen in the community over the last couple of years.
Go ahead.
So how does this go along with the sheriff's department with their Narcan, however that works? When they have to go recover somebody for an overdose?
So this will pair nicely with that actually. So when our law enforcement agencies or EMS are responding to a non-fatal overdose, what they'll be able to do here is contact the rapid response program. And so in addition to having those law enforcement and EMS supports available, there will also be a recovery coach coming out that can follow these folks and help get them wrapped into community service and wrapped into the recovery community. So the intention of this is to work with all of our law enforcement agencies.
And hopefully prevent future overdoses.
Okay, do we have a motion?
I'll make a motion to authorize acceptance of public health and safety team grant in the amount of $148,102.
Second.
Don? Okay, we have discussion, anybody?
Is this program similar to what's been introduced in Florida right now? I'm just curious. There was a new program about overdosing and how they're trying to really monitor the fentanyl, because apparently fentanyl is like, what, 70% of all overdose deaths at this point. They had a new program and they were talking about it, and they were more looking at, is this a new way, I guess, of coming at helping with overdosing and so forth? Is this something new or different than what we have been doing prior?
Yeah, it's a new add-on service. We're actually looking at other funding opportunities to hopefully support this pilot for a longer period of time.
Anybody else? Good. You have any questions? This is a pilot program, is that correct?
Yes.
Most of these funds are being used to support this initiative in the community. They're not really going to be spent by the health department.
I do not have any concerns with the budget transfer.
Okay. Just checking.
Thank you.
We have a vote.
I
Fine. Item 6. Resolution authorizing the sheriff's office to accept reimbursement grant of up to $150,000 medication assisted treatment program in the state of Wisconsin for comprehensive opioid stimulant and substance abuse site basis program. Who have we got here?
So I am Todd Christopherson, Chief Deputy with the Sheriff's Office. Accompanying me also is Captain Dave Mack, who oversees all the operations of the jail. Sheriff Motz wasn't able to be here today. He's having a medical procedure completed. So we are seeking acceptance of the $150,000 medication assisted treatment program grant from the Office of Justice Assistance through the state of Wisconsin. The money actually stems originally from the federal program for the Comprehensive Addiction Recovery Act in 2016 that was made available to states. We became aware of this grant opportunity in June of 2016. So we just received notice of receiving the grant late last week, which is thank you for the accommodation of going out of order. So this has not gone to judiciary and public safety yet from a timing standpoint. So we were awarded the grant the last week of July. It opens on August 1st and it closes the following July 31st, 2023. So they have us on very tight time restrictions, which is typically we don't like to come before you folks until judiciary has reviewed it. And in this instance, it made sense. So it's $150,000 funding and it covers the cost of the medication. So the medication you see in there is referred to as naltrexone. More commonly, you probably heard of it as Vivitrol. It's an injection. The DA's office has a program for it. They have funding. Probation and parole uses it. Human Services uses it through Solutions Recovery. So this grant was identified solely for law enforcement agencies, which is why we pursued it. Previous to this, it was cost prohibitive. $1,500 a shot. Very expensive. So when people come into our jail, we put them through detoxification protocols. It's a voluntary program, so it's a volunteer, not a voluntold. So they go through the detox, they work with our health providers. The health providers determines when they're ready for that. They get their shot. Sometimes it's right before release. Sometimes it's earlier than that. That's an independent medical decision that's made, and then each shot lasts about 30 days. And what it does is it blocks the receptors in your brain that actually receive opioids. So even if they go out on the streets and they inject heroin, they're not going to get the high from it. And that's the purpose of it. Much like the item that just occurred before it is in the prevention model. So unlike Narcan, where Narcan is the person did the drugs, they're overdosing, we show up and we try to counter the effects of it. This is preventative to where they can't even get high if they want to get high. So Dave is actually partnered with our human services. He is with Solutions Recovery and the Overdose Fatality Review Committee to lead this program. So if you have any program specifics, the nuts and bolts of how it's going to work, he's the resource to ask.
Let me just say that Mr. Stafford was called. He has you on their agenda for Monday, I believe.
Yes, sir.
And this is the same thing you're going to be going through with him.
Yes, sir. And then contingent upon this committee's approval and then judiciary.
Right.
We're
We're
going
just going out of sequence just to get it approved. Was there a reason for approving it before the weekend? Is there somebody that is getting released that you wanted to do this with?
We won't be able to formally acquire the product because it is so expensive until we actually get authorization from the board. We do have the capacity though. We have nursing staff that are qualified to do it. They will need to go to through a small certification programming. Our health authority that we contract with as part of our jail medical services, they have the capacity to do that. And we also have the storage capacity because it has to be stored at a regulated temperature.
So it has to go past the board before you
Yeah.
use it. Okay.
Yeah,
so-
we're law enforcement. We follow the rules. We can't start buying the patrol until we get the grant money approved.
So I would like to make a motion.
Would you like to make a motion?
Yes, to authorize the sheriff's office to accept a reimbursement grant of up to $150,000 for medication assisted treatment program in the Wisconsin Department of Justice Division of Law Enforcement Services Comprehensive Opioid Stimulant and Substance Abuse Site-Based Program.
Second.
Got a second out of Dave. Okay, got any discussions? Yes, ma'am.
I am so excited about this when I read this. I did a tour. They were nice enough to just take me on a personalized, it's just me, all over the tour. And I realized, and I didn't realize, I told other people this, that a lot of people who come in now are so addicted to drugs that they don't move around, their muscle capacity is deteriorated, and they're in wheelchairs, and they can't, I mean, they're having to do so many more medical stuff, and this is very exciting. I think this is gonna help quite a bit, and I was fortunate enough for them to tell me about, well, this drug in particular ahead of time, so an enthusiastic vote today from me.
Anybody else? Yes, Dave.
I'm just curious, I guess you got $150,000 and it said it's $15,000 shot. That's,
1,500.
oh, 1,500. Okay.
1,500.
I thought it said 15,000.
Sorry, 1,500.
Okay, I was gonna say, that's only 10 shots. That ain't much per year.
Yeah.
I'll get
Per
100.
person. Yeah, we increased it by 10 times.
Got a question out of the
Just for clarification, is the grant 150,000?
Yes.
If that's the case, since I'm looking at the resolution, I would remove on line 3 in the title, the words, the grant of up to, it's a grant of 150,000. That's just that one. If in fact it's 150,000, because I know the agenda item request.
We're gonna move up to, cross that out of your resolution.
And also on line 22. Again, it says up to a grant of 150,000. I'm sorry, what?
It's a friendly amendment, and yes, I will take that friendly amendment of removing up to, and this is what happens before it gets to judicial, if it doesn't go to judicial first. is what
Do they already have their sheets?
Judicial?
Yes. Or are you gonna go
They
and,
should have.
Oh,
are you gonna go and say the same thing to them?
Oh, I'll be there.
Okay,
I'll be there. I did not draft this at this point, so just.
Okay, and
do we have to
make them
vote,
aware, Miriam, make them aware of it right away.
do we have to vote on that change then?
No, it's a friendly. Okay.
And the
So,
person who seconded me, is that okay? I can't remember who seconded.
I did.
Okay, are you okay with the friendly amendment too for second?
Yeah. So let's have a vote real quick.
Hi.
Aye. Fine.
Thank you.
Good luck with it. Okay. Number 7. Mark. This is the resolution authorized payment, excessive committee days, April 1, 2021 to March 31st, 2022.
Second.
We haven't, I guess, authorizing the sheet. What, you want to say anything at all about it?
It will have to go to, if I may, I guess, and I'm sure Mary Ann or county clerk's office could explain better than I, but basically there's a statutory requirement that per diems for county board members can only be paid in excess of 30 days of committee meetings if approved by the county board. So our practice has been to basically add them up at the end of the term year and submit them to the board for approval after the fact. And so it's a process we go through regularly to identify those over 30 days per diems for committee meetings. The county clerk's office collects those, which are the sheet, identifies which ones are in excess, and then a resolution has been drafted, submitted to the board to approve those.
So you come in, so I didn't realize you had answers here. Would you want to elaborate on it all?
It's exactly what Mike said. Each month we create a report, which is this one here. I can say we do not let the supervisors know if they're close. You know, that would be something that we could start to do. The supervisors have already been paid for all of this.
Yes.
But it's, like Mike said, it's a statute that we have to do this and it has to be brought to the board to approve.
We are one of a few committees in the state that do this.
Okay. To,
I mean, as of a couple of years ago, I didn't check lately, but we are one of a few committees in the state of Wisconsin that do this excess.
reconciles the report to the money paid.
Correct.
Okay, and so what we're doing is we're voting it okay to reconcile it and to pay, go ahead and pay when we vote, to go ahead and pay the money that we've already paid. So you want to make a motion?
Make a motion for a resolution to authorize payment of excess committee days, April 1st, 21st through March 31st, 22.
Thank you. David, second. That's who's got a motion. Okay, we have a vote? Yes.
I thought last year about the same time that they made a motion that we weren't gonna pay in excess of them. And if they had them, that we weren't gonna do it this year. I mean, I'm fine with approving it, but I just think we should check from the last time, because I thought that we basically amended it, that we were paying over 30. I don't know if Mary Ann could check into that before the county board meeting. I'll vote for it. I think they should be paid. They served the time. But I know there was a few supervisors that.
I don't remember us voting on it. I don't remember us saying that was a rule.
I remember us saying that we didn't want to. And I think did we not fix this time with having the committee spread out more between more people? I mean, for next year, this year we don't have a choice. We gotta approve this.
Well,
I don't
we
think
were
this will
just- we were
happen
just-
next year.
we were just told by Tom that we cannot take an extra $50 if we go to 2 meetings in the same
one
day. So I dropped one of mine, I would imagine.
But if you go to 2 meetings in a day, you can claim the $75. I mean, if I go to a meeting this afternoon, that's 2 meetings, I should be able to claim the $75.
You can, plus
And
mileage.
that's the way it's always been, as far as I know, from what I used to approve and stuff.
Plus the mileage on the both the meetings.
Right.
Not $250 is what they're saying. Correct.
Yeah, not $250, just $175.
Right.
Or change my. Okay.
You can't donate $25 to the.
Oh, leave it be. Okay, so let's have a vote on this.
Aye.
Aye, 5-0. Thanks, Julie.
Hey, I have a question. You got Ramos as an extra committee day. How can that, oh, maybe it isn't. Never mind.
Thank you.
Item 8, which is employee compensation study. Mr. Winnebago.
Thank you, Mr. Chairman. I wanted to bring the committee up to date as to where we're at with the compensation study. As you should be aware, we had sent out a request for proposal in May of this year to various consultants. We received those responses in mid-June, and we received 4 responses. Ultimately, we ended up selecting Mcgrath Consulting Services. They're the same company who had done the last compensation study in 2016. In mid-July, we finalized the purchase of services agreement and had that fully signed and executed. And then the following week, so in late July, we had our initial phone call with the consultant, identified various types of data that they needed initially, reviewed the scope, goals of the project. And since then, we've been compiling and providing that requested data to the consultant. Now, all of the responses we received had roughly the same timeline. We provided in the request for proposals, basically our ideal timeline, which was to get responses back and presentations made in October prior to the budget hearings. All of the, and we said that's our ideal, but you let us know if, you know, what's realistic from your end based on what we're asking. All of the responses came back with roughly the same time frame of taking approximately 5 months. So we're looking at probably, I mean, we're still going to have some information as far as conceptually, you know, where we're headed, but we're not going to necessarily have a hard numbers and plan by the time of budget hearing. So we're looking at about 5 months. The intent is going to be that right now to have the consultant come in and actually do a presentation to this committee and talk about, you know, everything in detail, as well as then ultimately to the full county board. So we'd be looking at having that done, obviously, when all of the study is complete. They're just a little bit about Mcgrath Consulting for those of you who weren't here in 2016. They specialize in public sector consulting. Their team has Wisconsin city and county professional government experience. They're currently doing a study for Rock, Marathon, and Eau Claire counties and the city of La Crosse. Part of their deliverables are going to be a teachable point factor system that we'll be able to use in human resources moving forward for job analysis to help keep our system up to date. So whether that be, you know, new positions are requested, or even every year we do the reclassification requests from departments, providing us with a similar tool that the consultant uses so that we can have some consistency moving forward with those types of requests. Again,
Cost involved?
we have 90,000 that was approved. Will be around 66,000.
Additional,
No, 66,000. So
66,000 and on this point system and on a presentation later down the road, another year or so, do they add on to that?
once they've delivered everything, which includes the presentation, the PNF, the presentation to the board. I mean, if in 2024, 2025, we wanted to have them come back for something, that of course would be an additional cost, but the $66,000 covers the current compensation study.
So 24 under. budget.
Correct.
Just out of curiosity, when they do their compensation studies, a lot of places have different types of benefits than we offer. So it's like, we're competitive on a CNA and wages, but we offer nothing towards daycare and things like that. So if we're gonna be in this new environment, I think it's more than money we have to look at, because we're not gonna entice somebody to come here when we are paying about probably a quarter more now for a CNA than the average nursing home. So, and we're not getting, we're 39.5 CNA short. So we have to basically offer something that other people, like daycare is really a big factor, especially for young people. So I think when they're doing a compensation study, we have to know what we can do to entice employees to want to come to Winnebago County, because we can't keep operating at the rate we're at.
And yes, and part of the study, I mean, it's not solely taking a look at wages from a market standpoint. We're looking at everything that the county offers. It's not the focus of it isn't on the benefits, but the benefits that we offer are certainly part of that picture. One of the things we've also talked with the consultant about wanting, they're seeing based on their work across the country, but specifically in our area in Wisconsin, challenges that our employers are facing, as well as what different places are doing. I mean, are there innovations that other employers, other counties, other municipalities are doing that we're not doing that we could consider?
Like bonuses or
A
sign-on
variety of
bonus
things,
or
yeah.
what have you.
And also, just because someone's doing it, what's been effective, what's been working? Do they have recommendations about
Best
things like
practices
that?
type of thing.
Absolutely. And although the focus really is a recalibration of our current compensation schedule, one of the things that we've talked about, and I think we talked about this originally with the committee, is ideally we want to have a systematic, comprehensive approach to address wages as a whole, because we still obviously will need to be flexible based on specific need, whether that be the highway department, Parkview, or the sheriff's office, or any of our departments. But we're really at that point where we have such a need across the board that instead of bringing solutions piecemeal and bringing one job group, one department, or those as a piecemeal, trying to do something comprehensively, I think is going to be in our best interest, and it's also going to, I think, help the board in when you're evaluating what is this going to cost, what are our priorities, where are we going to spend those dollars, knowing what the recommendations are as a whole. If you choose to make piecemeal decisions, at least you'll have that big picture information, because I think some of the things that we've done, and I think rightfully so, because we've got to respond to current conditions. We have to get people hired. We have to be able to accomplish the mission that the departments have. But when we are flexible and we do that piecemeal, we don't know how it's going to shape out later on, and when we do this comprehensive approach. And so that's really what I guess my vision is for this compensation study, is that we can present the committee and the board with that overarching plan of where are we at, what are options to move forward, and how will that affect our employee group as a whole.
Will make us more proactive, I think.
Absolutely.
And I think what you have to be, if you're looking at new employees coming on the scene, you have to have narrowed down enough so you know what you've got, what your needs are, and that you can go out there in advance so that you don't have a lot of people coming in that you can't find the training for, because you have no interlocking between people that are there and the people, you know what I'm saying? It's similar to what we talked about just before the meeting. It's what Mr. Topple, Dr. Topple was having problems with, the interlocking of people coming in, and nobody there to train them, or people leaving and leaving a vacancy and not being able to fill that vacancy fast enough.
And part of the dynamic that we're facing right now too is that, you know, there's a budgetary pull, I would say, between recruitment efforts and retention efforts. Because if we just raise starting wages to help on the recruitment, well, then we've compressed wages and we haven't necessarily recognized or taken care of the employees that have been here, have that experience. They don't need that training and they provide that support. And that's always the case. But again, getting some of that feedback from the consultant as far as how to best address those things so that we can ideally work on both, because we can hire all the people in the world if we're able to, but if we can't keep them, that's not really helping us. And if we keep people but can't hire people, that also isn't helping us. And so it's really trying to find that sweet spot of how can we be a competitive employer, a desired destination for employees to want to work here, realize some of the benefits that we do offer that maybe others don't. But at the same time, keep and reward those employees that are here.
You know, and we got a great retirement system, but before Act 10, the county paid, everybody paid the whole premium. Now they pay half, it's almost 7%. So you're not even wage competitive. When you take an RN making $30 an hour, it's mandatory, she puts $2.10 in her retirement. So, you know, you can take somebody that's 22, 23 years old, they're not thinking about retirement. They're thinking about buying a house, buying a car, and paying for daycare. You know, so it puts you behind the 8 ball, because the other place is paying $32 an hour. They keep the whole $32. With us, they only get $29 because we make them put the money in retirement. It's not optional, it's mandatory. So it makes it harder for you to recruit somebody. It's great when they're 50 years old and they can retire at 57 and they get $4,000 a month. It's great. But when they're struggling to make their house payment, their daycare, and their car payment, and they can't touch that money until they retire, it's harder for you. And somehow we have to figure out how to do that and make it come out so that we're more competitive, you know?
Right. And I think one of the things we try to do now is when we make those job offers, not only do we explain that, yes, you're going to pay the 6.5% that it is now, soon to be going up. But how do we present, how do we explain the county's also paying now a matching, we're matching that and making sure that candidates know that there's a county match of equal value. Because if we don't explain that and educate them about that, that won't necessarily be seen as a value. And you're right, ultimately, at the end of the day, some of those benefits won't help them pay monthly bills. But if they're aware that the benefit's there, and that in this case, it would be a match, hopefully they see some value in that too. So,
Mark, can you take a waiver as an individual coming in and avoid getting it pulled from your for a temporary period of time?
No, that's part of the structure of the Wisconsin retirement system.
Yeah.
So that's not optional or at our discretion.
I don't know that it's-
I kind of don't disagree with it either.
Yeah.
So, sorry. I
Yeah.
don't disagree with the way the structure is, so.
So really next
Sorry,
steps,
Steve. I don't.
next steps that are coming up. I wanted to talk to the committee first, let you know where we're at, but I'll be contacting department heads, giving them a heads up and keeping them in communication of where we're at. The consultant's going to be meeting with department heads and their teams. We'll be talking about different issues that individual departments are seeing, because obviously departments may have specific challenges. I mean, everyone may have that same global, how do we recruit, how do we retain? But whether it's, say, the mechanics at highway, or whether it's a certain position in this department, or maybe concerns regarding internal comparables. Each department may have some of their own challenges. And what I've told department heads so far is that, you know, this really needs to be a collaborative approach. This isn't something that, you know, human resources is doing the study, and at the end of the day, well, you know, we may not like the results, or we, you know, everyone's got to have input in this, and we need to really have ownership county-wide in the process, because it's going to affect all of us. It's going to affect all departments. And while at the end of the day, I can't predict, but we may not agree with all the recommendations of the consultant, or we may not, you know, the county may not choose to implement all the recommendations, or we might not be able to afford all those recommendations. But regardless, I think it's important that all of our departments have a voice in the process and feel that they've had an opportunity to share their concerns with the consultant. So again, we can have a comprehensive, thorough review of what we're doing.
So you're gonna bring it to this committee first, right?
That's the intent, yes.
Are you gonna have 20 different departments in the room at the same time?
No. When the consultant comes to this committee, the idea would be that she'd be doing a presentation to this committee
To this committee?
of after the fact of
Direction.
what she's found, direction, recommendations, be available to answer questions. Why did you look at this, or did you look at that, or, you know, you're recommending this, why are you or aren't you? Those types of questions, an opportunity really for a robust discussion that way. The meetings with department heads would be individually with the department and HR and with the consultant to talk about their concerns and what needs that they may have specifically as a department.
I think wages will actually be tough. I mean, net new construction, I believe this year, Mike probably knows, I think we can raise our property tax 1.3 million. That's all we can raise taxes. So, you know, when you look at $190 million budget, what we have in net new property construction is 1.3 million. So
3%.
yeah, 1.3%. What does that come out to?
Well, it's of 75 million, not of 100, so it's about $1 million.
Or $1 million.
I've done the math, actually. I just got those numbers yesterday.
Yesterday. So, you know, we don't have a lot of money. Where it's gonna come from out of reserve, where it's gonna come from in the future. I don't know, you know, I
Well, it
mean,
has to be done, though. I mean, I've been through a few wage studies at the school board, and I mean, it's, you gotta pull it from where you need to, or you don't, I mean, what's our FT negativity, I guess. Did I say that correctly? How many people do we need? How many open spots do we have? There you go. Easy for me to say, right?
We've got over. It's a little bit different because with Parkview, we hire based on FTE, where other departments, we actually, a position's a position, or a part-time's a part-time. But yes, we've got well over 90 vacancies right now out of a workforce of roughly 1,100.
Which causes fatigue with the people who are working, and that's where you get your retention down. So yeah. It's a necessity. I'm glad that you're coming 24,000 under budget. That was surprising. So
Dave?
My concern is that all those dollars are still out there, that all goes back in the general fund and not to the executive's funny money account.
Well, you know, anything that's unspent goes back, anything that's unspent goes back to the general fund. So any additional expenditures, obviously the board would have control over.
can you define funny money?
It's money that's left over that they don't spend, that the executive gets to spend when he pleases.
It doesn't go
I wasn't
into
aware
executive.
that he could spend money as he pleases. He even had to come to beg for
Well, you
us
haven't
for
been here-
an
you
employee
haven't been here
appreciation
long
party.
enough.
I'm not sure he could just spend freely.
Well, he does have a contingency fund. up there somewhere,
Sure.
but be careful. Anyway, do we vote on this? I don't think so.
I just wanted to give you an update, and if there's any
Information only.
feedback or suggestions, anything that you've heard me say that you'd like to either get clarifications or provide.
It's still so far out. And we have issues coming up within the next month that are going to need to be looked at because of wages and because of a need for people there. One of them being, it was brought up, the only 3 mechanics that we have in highway. And the fact that they're making under, their wages are under standard at this time, and they think that they need a wage hike.
Well, and that's with all the departments, again, that's where, on one hand, we want to be flexible and responsive, but yet at the same time, we could probably make that argument.
We're ready to lose one person out there with regard to the.
And then that's why you very well may still see resolutions come before the committee and the board before the study's complete. Recognizing.
Prioritizing.
Absolutely. So
areas.
as much as we want to have a comprehensive, systematic approach, there still has to be
Sure.
some priority.
That we don't want to start another daisy chain of things happening because we've raised 1 or 2 particular, grades of employee. And then suddenly everybody thinks that they behind it need another raise, but we need this wage study done so that we don't get into that daisy chain effect.
Absolutely.
When I said prioritizing, I'm sorry, I meant prioritizing the section of the wage study is what I don't mean take an individual out. I was considering, that was my, I'm sorry. Are we on the same page with
Yes.
that? Okay, so the wage study prioritizes certain areas to have it completed, or can we not make any recommendation till the entirety of the wage study is done?
No, they'll present their information and recommendations in entirety. However, there may be requests from departments.
Once their section is completed?
No, I would say even before then. I mean, we've had already this year, we've had special requests and things like that.
The CNA thing.
Yep, and those things potentially could continue. But again, best practice is, I think especially because we're in the start of this process, is to really get this process done so that we don't have to piece.
We're talking 5 months.
Mhm.
That is almost, that puts us beyond the first of the year. That, that's crazy. We were last year at Christmas time talking about a wage study. And we had an RFP that we wanted written.
Government.
Yes.
Technically, we appropriated the dollars. Now it's up to him and the executive to come back with, that's technically how the system works.
Well, and that's part of why I explained what we
I understand.
requested as far as the timeline, and everyone, all the consultants, vendors were pretty unanimous in how much time it takes, and we're certainly sensitive to the budget timeline as well as to the departments and the employees. I mean, this is something that the sooner the better, but we also want a quality. Yeah.
There's nothing we can do to speed it up.
We didn't have a finance director, so we
Well,
still
we
have
can't
a finance
speed
director.
anything up.
So for
because
over
it
8 months,
doesn't-
we're operating with a finance director, and you two basically had to fill that gap. So it's like, how do you operate when basically you're missing a finance director? So we took the human resources director, gave him the finance job, took his assistant, gave him the personnel job, And, you know, we still don't have a finance director, so it's like, we're operating this county on a shoestring, and hopefully we can hold it together till we get the people in
We
here.
will, we will, be positive.
I think we have a great finance director.
I think we're doing better, so.
Well, the
Thank you for
CNAs
the
went
update, though.
from 25 CNAs to 39 and a half in a year. We almost doubled the amount of CNAs we're missing. We got it,
They've been over 30 for one.
well, we're up to 40. 39 and a half now.
Yeah, it was over 32 years ago.
We gotta get this where we can basically get the residents. I had one lady call me like for months. She couldn't get out of the hospital because she had COVID and had no nursing home to go to. And she goes, you got all kinds of beds at Parkview. Why can't I go there? I said, because they got nobody to take care of you. Might as well go home. We got no staff.
Mike, let's move on. Let's get to the,
All right, I want to give my report on several financial things, just to update the committee. First of all, the capital project status report was the first document in your folder. I apologize for any impact this may have had on your optical bills, because I look at these things online. I did not realize how it was going to turn out, such tiny print. But the intent of this document, and I can certainly provide you one, you should have received one, I think electronically, is to advise of the status of all the capital projects that have been approved, both this year and prior years that are not yet completed or that haven't been previously reported as completed. So this list said projects that have been approved as early as, I see one for 2016 on the airport terminal isn't closed out yet.
yeah.
Yeah.
Some of this is held back because of billing.
There are always various reasons projects aren't completed or the billing isn't caught up and so forth, but I did go back to each of the departments, ask them for an update on exactly where they are. Is the project in process? Is it completed? Is there more money that's going to be spent? Is there more money that's going to come in? So we tried to give you just a high level update as to where each of these are. You know, a lot of it's in process, a lot of it will be wrapped up this year, a lot more won't be wrapped up this year and won't be finished this year, and we'll be looking at it again next year. But, you know, it looks to me, just comparing this to prior reports I've looked at, to be kind of the typical spread of, you know, things always taking or often taking longer than expected, but we get there eventually. So if you have any questions about any of these projects, obviously there is a lot more detail, but I wanted to give you really the high level overview of the status and how long these things take. These are just to recognize the capital improvement projects. Those are the big ones that go have a presentation to the board, get approved kind of outside the budget as a separate capital improvement project.
In the future, can we just get 11 by 17?
We'll find a better way to present it in the future.
Or look with your iPad, because you can see it really
Yeah.
big.
I thought of bringing it.
It does work a lot better that way, so I only looked at it that way, so I have to confess, I didn't even look at the printout. That's why I didn't realize how long it was, so I apologize.
I read my phone all the time. It's like my phone.
Get one of these for the little magnetic thing or.
There you go.
Your
I
technology,
know.
gotta use your technology. We pay for these iPads. It works very well.
All right.
I just didn't want to sit in my hot car for hours at the fair. That's all.
Trunk.
All right, I could move on. The next item I wanted to look at was what I just handed out. It says 2022 capital improvement projects. These are the projects that were in the capital improvement plan for 2022, and where we are on those, and what's been approved, what might still be coming. So this, I think, is an important summary to look at and keep in mind. So the first group at the top, the largest group, these are the projects that have been approved in 2022 so far. So all the capital improvement projects that have come to the board, been voted on, gotten approval. And we just have, you know, we've simplified this report from what actually comes out of our system quite a bit. But, you know, we've got the full project amount. That's just the amount that is approved. Some of these projects, like if you look at Grunman Boat Landing, there's a much bigger number that will be added to that. This is the part that's approved by the county board in 2022. It doesn't include all the projections for future years that may be associated with the same project. But just so we understand, this is the amount that's approved. Now, usually when we submit these to the board, the resolution says the authorization is to spend the money essentially out of the general fund. And then it will either reduce the general fund balance or be bonded, essentially be replaced. The fund balance will be replenished with the bonding proceeds. We only do the bonding once a year in the fall. Once we look at, all the projects, we don't do separate bonding. That would be very inefficient. We do one bond issue a year, see how much we need to bond for to keep the fund balance where it should be, and proceed that way. So these are all the projects that have been approved that are eligible for bonding. So I would expect some of them, and usually we just look at the smaller ones, we just pay out of the general fund, attribute whatever number we need to the bonding project. But if you look at the total, it does add up to a pretty big number, $10,730,000. We generally try to keep the total capital improvement projects, our goal each year, when we do the planning, is 10 million a year. So we're already a little bit over that. Main reason it's over is there have been several projects added that weren't in the plan. For instance, the morgue, there's another $1.5 million we didn't count on. There's a need, but it wasn't in the planning where we kind of outlined where we might spend 10 million. The 980 residential facility wasn't in that plan that way. And then the airport hangar construction, the 3 million was a bigger number than we had originally planned on. So it's things like that that puts a little bit over. Not at an alarming rate now, but at a rate where we can look at that and say we're probably where we should be for the year, and maybe should be taking a real close look at future projects before we spend too much more money. The middle section, there are 2 projects listed there that have also been approved as capital improvement projects, but we didn't even put in the resolution that they might be bonded. So I just had to treat those separately. Those will be advanced out of the general fund. There's not really a problem with that, or the contingency fund. The first one, the child care center, the resolution just said we were going to take that out of contingency fund. It's all going to with contingency fund a little later. Not really a problem. To do the fiber loop that way, it doesn't really matter, but the resolution happened to say it will be taken out of the general fund. But those really are part of the total capital spending. So we've actually authorized 10.874 million in capital spending as capital improvement projects, in addition to the budgeted capital spending that's part of the annual budget. But then I looked at the capital improvement plan we had just to see what might yet be coming. It's not really too bad. We have dealt with most of the projects in the plan, but there's a list of the ones that have not been addressed yet by the county board or presented to the county board. Some of these may come forward yet this year. Others I think will not, but I can't say for sure. The airport plow truck, little airport project. Some of the UWO projects, they presented on a couple of the 3 projects in the July meeting. So we had the astronomical observation facility. It's a very small amount for this year. It's a big amount in future years.
Yeah.
So that'll be something the board will obviously want to discuss further. We'll look at next year. It's still in the plan. It's still their request. The nature center updates and moving down the last UWO project, building and land purchase for 750,000, which is their largest. I don't actually anticipate those going forward. Can't make
Right,
a on that.
They're all going forward other than the nature center, and that they're gonna fund through a foundation. But
Yeah.
the rest of those are all coming forward.
The building purchase, you think, will come forward?
They're doing an appraisal on the building,
Okay.
and they,
So the ones that are missing the outside funding, are those the ones that Outagamie County did not?
no, Outagamie County approved their in the budget. We approve ours individually, like when they do their budget in November, like we do our budget, Outagamie County approves their stuff in the budget. They don't come back to the board individually throughout the year to approve their capital improvements. John, our new county exec, would like to do our projects like that in the budget so that we could send them out for bids January 1st, because that's how most counties, they send their stuff out. And by the time we send them all for bids, they're all filled up. So they basically bid us higher because they already have their summer full of work. So Outagamie County basically approves those with their budget. The nature center, they're gonna get that money from a foundation. They're not gonna ask for that. But the rest of those, they'll be coming forward. And all these numbers are cut in half.
Yeah, that's a mistake on the floor. There should be outside funding numbers for all the UWA.
They're all cut in half.
All right.
That's my
School
mistake.
districts also do that, where they do everything in the budget, and then they get a better rate for that. I was surprised when we didn't do that.
Yeah, it makes more sense to get the stuff bidded out the first of the year rather than, we're bidding stuff out and the season's pretty much over.
If you look at, I just want to explain on the UWO projects, the West Campus parking lot, that's when they presented on that. I've never even seen their numbers on yet. So I'm a little annoyed about that. I emailed them.
Oh,
days
yeah, they
ago and
did,
haven't
did
gotten
they?
anything.
Yeah, you're right.
I emailed them after the county board meeting saying I need to see more numbers. That's a new project. We never saw anything on yet,
Yeah.
except the presentation. So. I
Isn't
don't-
that where some of the county executives' funny money comes in? where
Probably,
they use it- use it
It's
internally
probably
in the
buried in
highway
the parking
department?
lot under the asphalt. But,
Academia, I love them.
I've actually had no idea I've never seen that project. I'm on the UW.
Yeah.
And I've never seen that. I mean.
Well, they
have
presented
They
done it.
presented it at the last board meeting.
They came for we're gonna reconstruct the main entryway. But the $300,000 for the west parking lot restructuring.
I just threw the $300,000 number in here with a little note, if you see at the bottom, it's just a placeholder, because I had to put a number in.
I thought that was actually.
I don't know the number.
The seal coating, I think it was 80,000, and that's coming out of the parking lot, like we charge $50 now for student parking, and that money is in but that is actually, I think, crack filling, seal coating, and striping, and it's like 80,000, not 300.
Okay,
That we presented to the county board last month, the 300,000 we never, there's no parking lots to be reconstructed, we just reconstructed one, and the other one was reconstructed about 10 years ago.
I
So
thought
other
they
than the
had
main
both
entrance-
of those. I think they
Oh.
had a sealant one that they were just gonna fill in the cracks, and then a complete construction of a parking lot
That,
also.
no, that, it's just main drive reconstruction for
Okay.
Steve, you
123,000.
mentioned that to me, you were sitting there while we were watching. I think you mentioned that to me.
Right.
Okay,
well,
well,
they
that's,
need to provide me with more information about those, so I'm not
yeah, I
relying
get it.
on any of those numbers at all. I just wanted to leave them there as a placeholder.
Nope, that sounds good.
So don't accuse them of overestimating the project at 300,000, because that's just a number I threw out. I looked at a different reconstruction project and plugged that number in.
But yeah, they'll be presenting to facilities on the 25th, us next month, and the county board next month.
If I can move on, status of contingency funds, I passed this out, the second sheet I passed out tonight, if everyone has that, it's just a simple Word document. I want to simplify it. So we have every year as part of the budget, we set out, the board, county board sets out a contingency fund. It's a common thing to do, and we've been setting out $300,000. It's really just budget room for contingencies, unexpected expenses, and so forth. The current rule is that, which is our rule, is that this committee, Personnel and Finance, can approve budget amendments, moving money out of the contingency fund into particular department funds, but only up to $15,000. So for instance, last month, we did that to $14,750, I think, for $14,625 for, yeah, I made a mistake in the sheet. The second one was leadership training. It was the employee event.
No. 14,625 was the employee event.
Right, second one, apologize. So up to 15,000, it doesn't need to go to the county board, amounts overdue. Frankly, I'd like to at least have a discussion about that sometime, whether 15,000 might be.
How
kind of a
long has
low
it been,
number.
15,000?
I think it was raised from, it hasn't, I think it's something close to 10 years.
The
'cause I think
the last rule book,
Yeah.
or the 2021 rule book had it in there.
Yeah.
And it was before that, and Vicky told me that was due to be raised somewhere in the neighborhood of 50,000.
Well, with the inflation over a 10-year period.
Yeah, so I was thinking, inflation alone.
You probably can't buy anything.
Well, it's just a matter of, since the board has already set out this appropriation overall of 30,000, 300,000, we're never going to spend 300,000, 15,000 at a time. We don't get that many of those requests. But there are some requests that it would just shorten the timeline you know, if we could make it 25 or 30 or 50 or, you know, it's kind of an arbitrary number. But just a dividing line where it has to go to the full board for approval, as opposed to just going through 2 committees and the county executive for approval. You know, so we might want to consider raising that next year or something, just make the process a little easier to follow. In terms of where we are on it now, there was, out of the 300,000, there was that one resolution where we, for the UWO Child Care Center, that we took the 69,000 directly out of contingency. Because that was included in a resolution to the board, so that was done by board action in March. Then we have the 2 smaller items under 15,000, so we still have a little over 200,000 in the fund, just to advise you where that is. I don't know if we're going to spend that 200,000. Sometimes at the end of the year, we just, you know, pay for something out of that after the fact. Just
Christmas
to,
party.
no, it is not executive funny money. It stays there unless there's a specific authorization to spend it by this
Christmas
committee.
party coming up today, ain't there?
Christmas in July.
Mandy,
Ain't the executive?
It's not July
party coming up?
anymore.
No, I know, some missed their chance.
Mandy Dornfield is leaving the county, so they got a party up there for her. I was supposed to be there before 411, but I don't know.
That's what I'm referring to.
Okay, we'll try to move it on. So the other part of the sheet, there is a separate contingency fund set aside for salaries. And this year, which is not usually this large an amount, but this year we had 2 things going on at budget time. There was a major issue about the sheriff's wages that was being looked at and addressed, involving negotiation with the union. So the board, during the budget hearings, added the $786,240 as a contingency fund. We hadn't reached agreement with the unions yet or passed the resolutions authorizing the wage increases. So it wasn't put directly in the sheriff's budget. So our normal process for doing something before union negotiations are completed is we don't actually put it in the budget until afterward. But this amount, it's really just kind of a technical thing. We should bring that back to the committee for formal approval to transfer to their budget. But it's clearly set aside for that purpose. The wage increases have now been approved, both union and non-union deputies in the sheriff's office. So that number is fixed. That's coming out of that number. It was added into the budget contingency fund for that purpose to be later transferred out. So there's no real decision to be made there. But also during the budget hearing last year, there was a lot of talk about pay scales in general, need for the wage study, et cetera. So there was another $750,000, roughly $780,000, so that comes to set aside. It's probably an additional $750 because we usually put in that account $30,000 to $50,000 to cover payouts of sick leave, for instance, that can't be covered by a department's budget in certain circumstances. So there's usually just a small amount, a relatively small amount in this contingency fund. But we put another $750 in at the budget hearing to pay for departments that needed additional budget to react to the changing labor markets that were very much in upheaval at the time. So for instance, we've dealt with wages to some extent at Parkview. We haven't asked for a budget transfer for those because they haven't needed one because they have enough savings because of all the vacancies. So we probably will not need to use this money this year, except for things that are addressed through the wage study, which will really affect next year primarily.
Which would be nice if we could.
But we at least have that budget room set aside
Yeah, that's nice.
that we can then structurally move into the 2023 budget, which we are certainly looking at doing. So I don't expect to actually expend that salary contingency this year, but it is there if a need arises. If we need to do something, the latest hot button, mechanics in the highway department, they may or may not need a budget transfer for that. If they do, I would suggest it comes out of this contingency as an example. So questions further on that?
I got a question from on our, we talked about the mechanics that we lost and everything. How do we compare with the state? Do we look at how the state pays people? I know we lost the mechanic to the state from the highway several years back. has been more than that, but, you look into what the state pays versus what we pay?
In
Is that
some,
taken into
in some
consideration?
things we do. And I'm sure they'll be part of our comparables in the upcoming study, but when we lose people, I mean, it can be to not only so many different employers, obviously, but there's so many different reasons. You know, I mean, certainly when someone relocates and moves out of the area, you know, that's a given regardless of what might be paid. But can I say a little bit on that subject? I had some business at Quality Truck, and they were way behind on their backlog of fixing trucks. 'Cause my bus was in there, and he said they're just so short on mechanics. Well, when we took our tour, we were talking to a mechanic, me and Conley. And the mechanic said they're losing people to Oshkosh Truck, because Oshkosh Truck is paying so much more than we are. So, you know, Oshkosh Truck is short of people,
Right. And they're
and
sucking
they're
them up.
sucking them away from us.
That's right. And they have a union.
And I know at least one of them went from highway department to Oshkosh Truck, or Quality Truck.
There's one of three that are getting ready to leave. The three that you have now, one of three was getting ready to leave or thinking about it. Trying to incite somebody to give him a raise, I would imagine.
Well, they're class ones and class twos. The class one, the city of Oshkosh pays $2 more an hour, Allegheny pays $1 more an hour. So it's like, people just aren't gonna work for you if you're not gonna pay a federal wage. And we've been waiting for a wage study for almost a year. So we just keep losing more and more people, and, you know, I don't know how we get the money to pay them the wages. I mean, we'll have to find it somewhere, but
What does it do? What does it do if you don't have a good wage study, a good base for everybody? So that you start out at a good base. If you start paying people in the beginning on fear tactics, more or less, to pay them quickly and raise that one group, and suddenly the rest of the group decides they want to raise too. And what about the older folks that have, you know, been around a while? They want to raise too. And you got this daisy chain started, and a big company like the county, okay, can't afford to have it start in one spot and then go through the entire county.
We can afford employees.
Well,
You know what I
hey,
mean? It's
you
like
afford a wage study right away up front
that's what we're doing.
and get it done fast.
Another challenge we face though is that over the past year and a half particularly, the labor market has been changing so rapidly. You know, a year ago, Oshkosh Corp wasn't paying mechanics what they are now, so there wasn't that same pressure. It's changing. The thing is, you spend a year on a wage study, by the time the wage study's done, what you started looking at has changed already.
And they just completed their wage
Yeah.
study about 4 months ago themselves.
Yeah, so a lot of municipalities are doing wage studies right now.
Yeah,
They're very
Oshkosh
busy,
Corp did.
but you know, there's some things where you just have to be able to react. So that was actually one of the challenges we discussed with the Mcgrath people, is that, you know, we can't just take a long-term snapshot and assume that everything is going to be stable. We need better ways to react more quickly.
Unemployment did go.
Yeah.
What was it, up in the area just recently though too, so there's less jobs and anyway, I'm sorry.
And I'm just
Go on
saying,
to the next.
if we had done a wage study even last year,
It would be enough.
it would be outdated by now.
Mhm.
It would be outdated by now. It would not be that useful to us. We'd be wanting to do another one anyway. So that frankly was part of the consideration that affected.
Right. Let's stop and get the next item on the list, which is the resolution to commendation
Well,
of.
if I may, there was just, I did want to update the committee, finish my update on the 2021 financial statements and audit and the performance during the first half of 2022. I did pass out in the packet this the June 2022 budget versus actual analysis. It is kind of a high-level summary of the financial performance of each department halfway through the year. So it's a good time to look at it, you know, because it's easy to look and see, is that number bigger or less than 50%? But if you look at those numbers, please take them with a little bit of understanding that spending is not consistent throughout the year in every department. There are obviously a lot of things where you spend money up front or spend it toward the end of the year. You can't really just take this as a projection, and
Especially the smaller departments.
yeah, or especially ones that do certain big things, you know, that cost a lot of money at certain times, not consistently. But if you look at labor, for instance, you know, obviously if we see labor over 50%, it's going to be a concern. There aren't many that are over 50%, but we will go back and continue to monitor this. And if we're also, departments have just completed doing projections, actual projections as part of the budget process. But as part of that process, we ask them to project what they're going to spend through the end of 2022. So once we look at that, we'll then at some point go back and say, you really need to be thinking about a budget transfer if you are going to do it for the year. You know, to make sure we get ahead of that before the money is spent, it should be presented to the committee. So just to let you know, we're on top of that. And if you have any questions about this, you know, ask questions. We can drill down more. You can't just necessarily draw a lot of conclusions from that one number. And then I just want to let the committee know that we are have had our audit report filed with the state with unqualified opinion. It's very touch and go. This has been a new process for us, frankly. We have not had, you know, we've had, frankly, Doug Petrozek, who's now at Parkview, has prepared our actual financial statements every year for past, I don't know, 15 or 20. So it really has been a new process working with our auditing firm to actually prepare the statements based on the information we provide. So we've been working very hard at that. I give Carol a ton of credit as, you know, being the main laboring oar on that, working with the auditor. But they're also having to, you know, kind of ramp up their process. It'll be easier next year. Audit report is due to the state October 1st. So it was filed August 1st. It was filed with the state August 1st. I don't have an actual printed final report. I have a very close draft. They're working on the actual final thing now. Will be done by next week. We did get an unqualified opinion from the auditor, which is what you want. An unqualified opinion means, yes, we're certifying this financial picture for the county does meet audit standards. You know, and so there's no major material warnings or, you know, qualifications they have to give. They give a qualification.
Are we gonna have a presentation by
Yes.
the auditors
Yes.
here the next meeting?
I expect the next meeting.
What did the auditors think of that unapproved funding for when Ethan was here and the personal finance turned that down?
Well, they looked at it and they would have to list it as an unauthorized expenditure, but they termed it non-material because of the amount. It was not big enough to have a significant effect on the county's financials.
Did you have a phone call or anything was it no. I've got her.
Amber Drewiski.
What?
Amber Drewiski.
Amber, yeah. Did
Yeah.
you have a call from Amber, any of you?
Concerning what?
Well, Clifton had Amber call me and ask if there were anything that I knew, you know, that bothered me about the, you know, the budget or of the
You audit?
Is this a press person?
No, it's one.
no, I
it's
worried that might have been, but
Okay.
it wasn't.
Our auditor. It was our auditor.
Oh, okay. No, I have not received any phone calls.
No,
I
okay,
haven't.
okay.
They used to call, when I was chair of the PNF committee, they used to call me and ask if there were any questions that I had that they should have a concern about.
Right,
Stuff like
and
that.
that's exactly what she said.
It's really part of their due diligence, just seeing, you know, if there's anything out there they haven't heard about, anything they should be looking into. So they do a number of things. They talk to our banks, they have to get a letter from corp counsel. They have a whole list of things they do, you know, just to see if there's any issues out there that are being hidden potentially. So they do that. And what the biggest holdup this year that really brought us down to the wire was the Winnebago County Housing Authority. part of the joint Oshkosh. Winnebago
I'm
County.
on that one. I know what
And
happened.
you know, there have
I
been
know what
upheavals
happened. I
there
just
and
got the whole
problems.
lowdown.
It was like touch and go whether we would get, see, they need to have that audit.
I think they're finished, aren't
They are.
Yeah,
They
they
got it
just
like
finished it. They got it to us. Got it to
If
the
it had
county.
been, if it had been more than a day later than it was, we would have got a qualified opinion because they would have had to say, we don't have enough information to
Yeah.
attest to the audit regarding.
We
the
got
house.
it just in time. They had anyway, there was a lot of, I don't know. They had someone in there for the last year that was an accountant that did not use the proper auditing materials, procedures, materials in particular. They were using QuickBooks as opposed to a
Oh.
authorized
Oh, yeah.
auditing system. So now the new person who just got in, who we just voted in, they're on track to do exactly the way it's supposed to be done. So that's why,
So we were literally ready to get a qualified opinion and we're talking to the bonding people and how much is this gonna matter? And the answer was very
yeah,
little, if at all. But it's still not nice to get a qualified opinion, that unqualified opinion. And so down to the wire, they came through. So big thanks to the housing authority and their auditor for getting that
when you
done
get
much
a much better
faster
job.
than they expected to
So,
originally.
yeah.
But there will be further reports on that, just wanted to update.
Okay, item 10. Let's go to item 10. Are you done?
I'm done, so I think would be item 9, no, Mr. Chairman.
Yeah, 9.
No,
I-
it was Miss,
Oh, I'm sorry. Yeah,
You were
forget the
9.
old one.
you were 9. We
Oh.
are 10 now. So somebody like to make a motion?
I'd like to make a motion for a resolution of commendation for Beth Basinger.
Yes.
Is that
Second?
Basinger?
Do we get a second out of Dave? Okay. That was Betsy. All right,
Should we vote?
Any discussion?
any discussion at all?
Yeah, I didn't sign this. Normally I sign this.
You didn't sign it. We're not gonna sign it till it gets to the board.
Oh, we do it after the fact?
And that's what a county board, they approve it, and I come back on fancy paper next month, we sign it.
We didn't have anything signed this time around. So,
Aye.
Aye.
aye. We got 5 ayes. All right. Next meeting date is going to be
September 1st, 9 AM.
September 1st, 9 AM. 9 AM. We have a
I'd like to move to
resolution,
adjourn.
or
Oh,
can we have a motion to adjourn?
move to adjourn.
Second.
Wasn't fair.